Hello, this is Kelly Miners, and this is my evidence-based practice NU 6013 final project. This is my infograph, and I know that some of the words are kind of harder to see, but I'll go through everything and I will add my reference sheet with this post. So, what is evidence? Evidence is a collection of facts that are believed to be true. So, when we're going to start an evidence-based practice project by looking at a background. So getting your discovery, your spirit of inquiry, informing your PICO question. So the background to my PICO question is that when working in the neuroscience ICU, we were getting away from using indwelling catheters due to our high CAUTI rates. And so we started a new process of intermittently straight cathing patients that had urinary retention. And we had to do that a certain amount of times before we were able to place an indwelling catheter. And our CAUTI rates did not change much. So it kind of got me thinking, are we doing more harm than good? Does this frequent intermittent catheterization, straight catheterization, cause a higher incident of infection, or does it not? So that's how I came to my PICO question. In hospitalized patients with urinary retention, how does intermittent straight catheterization compared to indwelling catheters affect the rate of urinary tract infections or infection overall? So my population are hospitalized patients with urinary retention. The intervention is placing an indwelling catheter or to perform multiple straight catheterizations. The comparison are UTI rates between patients that have an indwelling catheter versus those that undergo intermittent straight catheterization, and that outcome are urinary tract infection. So that's the discovery part of evidence-based practice research, bringing in that clinical expertise. So seeing that what was happening at bedside, having a spirit of inquiry and an institution that supported that, and then formulating the PICO. So the next step is going to be looking at research, is finding research. So when you're finding research, you're going to have to look at different levels of evidence. And the three articles that I found to support my PICO are at different levels of evidence. So this first one is by Ma and Liu, and that was from 2019. And that was a study that they did, and it was a meta analysis research design with a level of evidence of 1, the meta analysis, according to the Johns Hopkins level of evidence. The population were patients that were having a total joint arthroplasty, and they were having urinary retention. So the current practice was to either have a catheter during surgery and take it out post-surgical, or they would have it for some time after surgery, and then, or there was patients that actually didn't even have one. So the population was 750 patients had an indwelling catheter and 783 had non-indwelling catheters. And what this study showed was that there was an increase of post-op UTIs, and they kind of concluded that patients might not even need a fully an indwelling catheter for these kind of patients, and that would help decrease their rate of infection. The next study is the Garbano study, and that was done in 2020. And that study was a non-experimental observational research with a level of evidence of 4, a cohort prospective study. So that study compared post-operative periprosthetic joint infections following intermittent versus indwelling catheterization after this surgery. So it was looking at both things of my PICO question. Does an indwelling catheterization cause more infection or just intermittent? And the patient population they did this study on was 734 had an indwelling catheter, 229 had intermittent straight catheterization, and both had 160 having both indwelling and intermittent. And what it found was indwelling catheterization, there's an increased risk of joint infection compared to intermittent straight catheterization. So that was definitely supporting my PICO question, is just on a little bit lower level of evidence. And the last study I posted was one by Hackroot, and that was a little bit older than done in 2011. And That was a multi-center randomized controlled trial study. So that was a level of 2 evidence. And it had 45 patients that got intermittent straight catheterizations and 42 that had indwelling straight catheterizations. And this was following a vaginal prolapse surgery. So these were all women patients. And what came out was the outcome was that people that had the intermittent straight catheterization had a much lower risk of bacteremia and infection. And they also had a quicker normalization of bladder emptying with that. So that was my evidence. So you find your level of evidence, you try and find the best research possible. And then you're going to look at patient values in participation. So the patient values is going to be, of the studies I looked at were post-surgical patients, patients with urinary retention, patients that you really don't want to have infections. So along with infection and a lot of these procedures come pain, increased length of stay, and we don't want to do that to our patients. We want them to have the most pleasant experience as possible. We want less infection, especially these patients with these joint surgeries. They don't want to have to redo surgery and redo the joint. So then that leads me to the model that I used for this. So I used the Iowa model because I was looking more at quality improvement, and that's the model that fits that the reason for the research the best. And so with the Iowa model, you are looking at triggering the clinical and clinical. So what do you, like in the beginning with the spirit of inquiry and the clinical expertise. So you're starting your project with that. So then you're formulating a question or a purpose. So what's the end goal for this? What kind of quality improvement are we trying to accomplish here? And then the priority. So sometimes quality improvement projects with hospital administration there's some that take precedent over others. So you're kind of looking at that to see if you can go on further with the study. So if that is approved, then you go in with a team. So you formulate a team, and the team can be a multidisciplinary team, and you get all them together, and then you do a research search. And so your team is looking for articles to support your question and your interventions and your what you're looking for. So after the team finds different articles, you come together, you analyze the literature, and you decide what are the best supporting articles for your intervention. Then you come up with what the change in the intervention is that you're going to do, the design and the pilot change, and you try and implement it. You try and maintain that change. And if it's successful and you want to share it, you make sure that you disseminate the results and share the results. So overall, my PICO question, looking at the CAUTI rates and if indwelling catheterization or intermittent straight catheterization was a better practice, I would conclude that intermittent straight catheterization had a lower infection risk than having an indwelling catheterization. And patients with urinary retention, one of the studies actually showed that it helped to reduce urinary retention if you're using intermittent straight catheterization versus having an indwelling catheter. So thank you for listening to my presentation. Again, I will post both of these on uh, the website, and good luck on the rest of yours. Thanks.